Sciatica. Is sciatica a single entity? No. Sciatica, in layman's terms, is simply leg pain. The number of actual clinical things that can cause leg pain, there's a very large number of potential structures. When you see a physio, chiro, osteopath, sports medicine person, you will come in, or the patient can come in with a self-diagnosis or pub or gym diagnosis of sciatica. Sometimes there's a slightly more sophisticated term they come up with, which is piriformis syndrome. There are numerous causes that will present like that. The clinician will go through the case history, establishing possible comorbidities, and then examine and treat accordingly. The number of people that have correctly come to me with a diagnosis, self-diagnosis, after looking at good old Google, who've correctly come with a sciatica diagnosis is extremely small. Most people actually have a form of muscle pain through various structures. There's no neurological symptoms, and sciatica is, in clinical terms, an impingement of the lumbosacral plexus and various neurological areas going down the leg. It is by far more common for it to be muscular, and believe you me, without a thorough case history and exam, you cannot properly exclude muscle pain from nerve pain. It is a detailed assessment that makes that more obvious. Another common one is actually joint pain, or of a few joints, not just one, or even ligament strain. And suddenly Pandora's box starts to open as to what sciatica can actually be. As to what you do to resolve it, well, it is different. I have had patients coming in where they say, my friend had sciatica, you fixed it in one. Well, that's because it was a piriformis syndrome with a isolated muscle tightness, muscle being piriformis. I may try and put a link below to show you a picture of piriformis. So, going to a clinician with a diagnosis, I urge the prospective patient to be mindful that they just don't have the list of possibilities that can be causing it. You know, a big one that can cause sciatica would be, say, a claudication, which is the vascular problem. It's got nothing to do with your nerve, even though there are nerves in your blood vessels, called angioderms. So if you come to a practice and you think you've got a diagnosis, do share it with the clinician, but be prepared for the clinician, if they've got the time, to try to carefully explain how your perception of your pain isn't substantiated after clinical exam. If we can, as a clinician, we will try to explain it. If our explanation is one that you as a patient just simply don't agree with because of your Googling, that's fine. We have no qualms. You're more than welcome to see a practitioner who agrees with you. But we don't have to agree with you, and we don't have to embark on our course of treatment if we don't agree. We need valid consent, informed consent, form a team, and we get great results. It's all about teamwork, and there's no I in team. Okay, cheers.